Good afternoon. Hi. I'm back. It's Olivia. On Reddit, you know me as Warm Yam 9000, something like that. And I am also known as Olivia K on Facebook. And I'm on multiple NCLEX study groups. So quick blur before I go right into this video. I just passed the NCLEX exam. I passed 150 questions, which is grand, and I am planning to help out people succeed. Sorry, I just took my seatbelt. I'm going to get my nails on after this. So yeah, quick background. I have been a nurse for 10 years. So I've been practicing since 2016. I've been a practical nurse. I started out as a practical nurse rather, and I've been working towards my RN for years and years and years. I finally got into Celsius around 2022, and I am doing the LPN to BSN. So I'm doing the BSN portion of it right now, and I'm doing the prerequisites towards that. And so I just earned my RN. Perfect. So my plan now that I got the RN and stuff, is to help out others. That's really what I want to do. I mentioned when I said in my Reddit post, I want to reach out and help people, because I do get messages of how people want to succeed, or they're asking me for sources, but I understand why people want sources. So I'm here to tell you, sources alone is not going to help you succeed. Memorizing what the content has to offer, that is not going to help you pass alone. It's really not. So this is how you're going to succeed. So whenever you take the NCLEX, RN or PN, you get the maximum questions. I think 150 now. I don't know if it's any more or less. So when you take it and you fail it initially, those CPR reports are very important. I know there's shout out to Nurse Regina. She was excellent, but I just didn't have the fundamental knowledge, so which I'm going to talk about in a bit. But she says rip out the CPR reports. Don't do that. Don't do that. They're very important, and I'll tell you why. Because when you're taking I wanted to say RN because I passed the PN one the first time, and I can barely remember the questions I got. I can barely remember, so I kind of have a harder time to figure out what a PN should study. I think mostly same thing, except with the managerial piece. So if you were to fail at 85, what it's going to tell you, what most likely it says, is that you don't know the content, or you're lacking knowledge in the content, and you're not able to critically think. Because as I always say in these other groups, thinking critically, that's very important. That's the number one thing. Number two, content matters. So I know people are going to say, people probably tell you in the groups, content doesn't matter because you're not expected to know everything, which is true. You're not expected to know everything. But the thing is, it's good to know enough content, because when you get a question, you want to know how you're going to answer it, right? And if you don't know what the content's telling you, how are you going to answer it? You know what I'm saying? And I'm not just talking for like pharmacology. This will be gaining towards like something like med surg, and especially when you're doing the NGN studies, because that's mostly in your exams now. It's not just your simple traditional with the four options. You have to also they're giving you cases like as if you're in a real world case scenario. And at the end of the day, in the real world, they're not going to just say, you know, you have these 4 options, what are you going to do, right? You have to learn to critically think. That's the biggest thing. You have to critically think. You are presenting these symptoms. These are her labs, or his labs, their labs. Given those information, what are you going to do? How are you going to approach it? What are you looking for? That's what they want to know. They want to know if you're a safe nurse, sorry about that, given with the information you're presented, what are you going to do to keep that patient safe? So that's the biggest thing. And that's why I keep telling people in the comments, like, it's very important to critically think, aside from having the sources where they tell you it's this, that, this, and that. And it don't get me wrong, you should know your labs. You very well should definitely memorize your labs, right? But you also need to understand those labs, those same labs or symptoms, and understand what do you do next. What's the first thing you do before you call the doctor, before you call the supervisor. So that's the point. So that's the very first thing I wanted to mention. And then also, like, how you study too. Like I said, so thinking critically. To think critically, it's a skill. Even though people tell you it's not a big deal, it is a big deal to think critically. It very well is, because not everyone has the ability to do that. And I tell people, the NCLEX is not an easy exam. I don't care what all these people say. I mean, all these people, you can get the A's and the B's and the C's. It doesn't matter. Can you be able to use the information and that you're given, and then also process the nursing process, right? ADPI, access, diagnose, plan. Can you intervene or implement what you're going to implement, and what's the outcome? So that's one of the things the nursing one of nursing cues, right? Like, you have to prioritize, look for cue, prioritize, and then what is the outcome of what you have done to keep that patient safe. So it's not just your source. So you have to learn how to answer it. You have to practice. So you don't just practice questions, but you also have to understand, not just answer it. You know what I'm saying? Like, I don't know how to explain this in a way where you can understand, right? Because I failed my NCLEX RN at the first attempt. And what was happening was I was just answering the questions. I wasn't listening to my gut as much, and I lacked content, because I'm like, okay, maybe it's this, and maybe it's that, and maybe it's that other thing. But no, I did not stop and pull out the most important information from the questions, because that's what you have to do. Because, like I said, to critically think it's taking time to understand the content, how to answer it. And the way you're going to understand how to do that is by processing the content, understanding it. And then when you're reading the question, you ask yourself, what am I being asked? What is the question saying? You want to know, is it a priority question? Like, what patient am I seeing first? And you also want to understand also with these patients, who is the most sickest and who's going to decline the fastest? Or with Maslow hierarchy needs, sorry. Ugh, sometimes I cannot words. With Maslow's hierarchy needs, with all these other needs, what is the most important need that needs to be met at a time? Someone that needs their oxygen, right? Or somebody who is in pain, or somebody who's being discharged. Who are you going to see first? Obviously, you're going to see the oxygen patient because they need their oxygen, and that's part of your primary needs that need to be met. Breathing, right? Shelter, hunger, but mostly like breathing, your basics. So another thing too, speaking of basics, I think people need to definitely understand fundamental knowledge. So I've been saying that in the comments as well, and every time I've spoken to somebody, the question is, do you know your fundamental knowledge? And when I say that, it means like safety, right? Safety is the biggest thing, because this is a safety exam. So with the basics, that's what you have to do. Like you take the concept of fundamentals and you're going to apply it to any discipline. Like I just mentioned, priority, delegation. Who is the right person to do this task in order to keep the patient safe? Then what else? IV. You don't need to know IV per se, but do you know the signs of an IV complication? And what are you going to do? As a PN, are you going to note the symptoms and then report to your supervisor? Or as an RN, what do you do first to prevent any more complications? So there's let me not use that example. So you see swelling in the arm, phlebitis. What are you going to do? Are you going to stop the IV from going, and then you elevate the arm? That's what you should do. That's the most important thing you should do. And then you prioritize what you do next, right? So it's very important to understand all these, concepts too, because if you're going to, get all these other questions, whether it's psych, mental health, like I just said, maternity, pediatrics, these kind of fundamental concepts will follow, like positioning, definitely. What is the right position a patient should be when they're dealing with this complication or that complication? So that's the whole goal. So I'll make more videos, but I just wanted to touch base with everybody, and hopefully that did make some sense. I am going to do maybe a fundamental, so people can understand what I mean by fundamentals, because it's not just your basic. It's basic, but it's not just a quick thing you learn, because I was told too, when I was doing NCLEX review with ATI, people tend to neglect the fundamentals, and you don't want to do that, because when you do, it's another reason why you are going to have a hard time answering questions as well. And I just saw a recent video, not recent, it's like 3 years ago. Dr. Sharon was interviewing Mark Hay, and what he was saying is that you have to have that fundamental knowledge, because no matter what nursing discipline you're going to be asked, you have to apply the fundamental concepts to it, like positioning, prioritization, management of care if you're an RN, and etc. So it's very important to learn and know all these things. Like I said, you'll be able to pass the NCLEX if you study the right way, not memorize. Practice how to answer questions like a nurse. Not just answer questions because it's being asked. Not just memorize your pharmacology meds, because they're essential high yield questions that will be asked with medications and even with diagnoses like from MedSurg. But you want to know the concept. That's the most important thing. So anyway, I gotta go. I gotta get my nails done because they are busted. And you have a wonderful day. And I'll be around, I'll be in Reddit and Facebook trying to see how much more I can help people out, because I do want you all to pass. And if I can pass after the second attempt, you can too. You can pass with even the third or fourth. It just takes time and practice. Anyways, take it easy and have a good day. Bye.